decided to compare counseling styles, and so we compared two different ways of giving that feedback. One of them was feedback in a kind of confrontive directive style. So if you tell the person, well, you're drinking more than 90% of the population, and the person said, well, that can't be. I mean, everybody I know drinks that much. That can't be right. You might say, well, now how can you sit there and tell me that when you and I sat here and constructed your drinking, and here are the drinking norms for the culture, and I mean, take a look, it's right there in front of you. Which was sort of common addiction counseling procedure at that point. Or in a more motivational interviewing Rogerian style, well, I don't think it's that bad. So this really surprises you. It's not what you expected. A reflection. All right. Well, without any further treatment, the red group is the confrontive condition, and their drinking decreases some. The yellow group is the group also getting feedback randomly assigned in a motivational interviewing style, and you see it's a steeper decline. Both of them maintained pretty well over time, and again, the waiting list control was very polite and waited for us. And then we did the checkup, and then their drinking went down. But again, with some splashback. I've seen this now in several studies, that if you make people wait for treatment, it doesn't seem to work as well as if you treat them when the window of opportunity is open. We found the same thing in a training study too, by the way, a training of motivational interviewing study, that when we trained people immediately when they asked for it, they showed nice improvement. Didn't maintain as well if we made them wait for training later on. So waiting lists are not necessarily a good thing. In fact, they may be pernicious. Yeah. Now, besides the counselors doing what I told them to do, because the same counselors did both conditions, so I had to train them up so they could walk into the room, open an envelope, and it says confront, and you can do that, or it says reflect, and you can do that. But I knew from watching that some of them were pretty good at one style and not the other style. So I said, well, what did they actually do? Not what did I just tell them to do, but what did they actually do? And there we found that one counseling behavior predicted client outcomes. It was confront. The more the counselor confronted, the more the clients drank. And it was a 0.59 correlation, pretty strong. We also found, by the way, that the more resistance behaviors we saw from the client, the worse their outcome was as well. But those resistance behaviors were under the control of the therapist. So if you counsel in a confrontive way that evokes a lot of resistance, you have bad outcomes, basically. That was what we were seeing in this particular study. We also took a look at to what extent did we get change talk, that is the client arguing for change, giving us their motivations for change. And in the more directive condition, we get half as much change talk as in the more empathic condition where we're listening. So if you listen well to patients, they say more things about why they want to get better. And we looked at resistance, and we got half as much resistance in the empathic condition. And it is, we know from subsequent research, the ratio between change talk and resistance or counter change talk that predicts behavior change. So you've got about a 3-to-1 ratio in the empathic condition, whereas on the directive side, you've got ambivalent clients, equal amounts of pro and con, basically. And it is an experimental product of the way in which they were counseled. So here we got pieces of a puzzle. We have brief conversations, brief interventions that make a difference. It definitely matters what the counselor does. So after studying this for so long, I'm very aware when I walk in a room, I need to pay attention to what I'm doing because what I say matters. I can't just sit here and chat, because what I say matters. That empathy predicts client change, replicated numerous times. That confrontation undermines change. People are less likely to change if you confront them than if you leave them alone. And given a brief intervention, clients went ahead and changed on their own without further intervention. Interesting. So then I went off on another sabbatical, this time to Australia. And in the office next to mine was this South African bushman who was at the time living in Cardiff, Wales, but working in Australia. So it's a man of the world. And his name was Steve Rolnick. And he said to me, "Miller, you the guy who wrote that article on motivational interviewing?" I said, "You read it? Wow, I'm impressed that somebody's read it." And he said, "Well, read it." "No, I'm teaching motivational interviewing all up and down the UK. It has become a preferred treatment for addiction, and I don't even know if I'm doing it right. There's just this one crummy little article, and you got to write more about this." You know? So I said, "Well, show me what you do." And the way he practiced had exactly the same heart, and exactly the same dance, and exactly the same rhythm in working with patients. I said, "Yes, that's it. Let's write a book together." You know? And so we did. And the first edition of Motivational Interviewing came out in 1991, focused on addictions. By the time our second edition rolled around, it had already spread into so many other areas of healthcare and social services that it wasn't about addictions anymore. And the third edition just in 2013, again, quite a different book from the previous two. So where are we now? Well, the MI books have been translated into at least 22 languages. There are more than 200 randomized clinical trials of motivational interviewing, including 10 multi-site trials. There are more than 1,500 publications directly about motivational interviewing, and something like 40,000 that in some way reference motivational interviewing. Across a lot of problem areas, there's evidence of this helping. So it's now being used in healthcare, mental health, addictions, correctional settings, more recently schools, dentistry. I can't keep track of the places this stuff keeps popping up. And it says there's something in common across these kinds of behavioral challenges that people bring. And ambivalence, which is kind of the heart of what you're working with in motivational interviewing, is just human nature. I mean, it is who we are. And the particular problem area it isn't so specific as the phenomenon of ambivalence, I want to, I don't want to at the same time, and how you work with that. There are more than 3,000 trainers working in at least 47 languages that we know about, and whole states and whole nations are implementing motivational interviewing in a correctional system or in a mental health system or whatever. So I'm just astonished. I mean, this started with an article that I hadn't even planned to publish, and it has just taken off like a rocket. This is Google Scholar articles by year, and so you can see the plot starts off with nothing and slowly picks up, and it follows the dissemination of innovations curve, heading for 40,000 articles now in 2013. So what is it? Well, it's a collaborative conversation style for strengthening a person's own motivation for and commitment to change. That's the way we describe it now in the third edition. That's what we call the elevator definition. If you're getting in an elevator and someone says, "What's motivational interviewing?" and you're getting off on the second floor, that's what you say. Yeah. Practitioners want to know, why would I bother to learn this? How is this useful to me? And there we say, well, it's a person-centered counseling style for addressing the common problem of ambivalence about change. Do you ever have patients who are looking for change and yet seem to be ambivalent or reluctant about it? You know, if so, it is the tool that might be useful to you. And Steve and I began teaching motivational interviewing, and about 1995 we began writing about the underlying spirit of motivational interviewing for a particular reason. We saw people using the techniques that we taught them, and we were dismayed. It didn't feel right, it didn't look right, didn't seem to work. Using the techniques without what we now call the spirit just was missing something really important. And what we said is we're obviously missing something in our training. There's something that we're not covering because people are going away and trying techniques, but they don't get what we're trying to teach them. And so we began to write about the spirit of motivational interviewing that now has these components to it. Collaboration, it's a partnership. It's not, I'm an expert, I'm going to fix you. I'm a teacher, I'm going to teach you these things. I'm a doctor, I'm going to repair you. I mean, it's two people having a conversation, companions on the journey, each with expertise. You have professional expertise. Your client has expertise. Nobody knows more about your client than the client does. And if what you want is behavior change to happen in their life, you've got to have their expertise involved. It's got to be a collaborative partnership kind of approach. Acceptance, fairly profoundly, like Carl Rogers was talking about. So a non-judgmental approach, a respect for what the person believes and an interest in what they have to tell you, and a belief that they have wisdom in them, and want to be well. Evocation, instead of installing things that are missing, that was kind of my training in behavior therapy. What clients are missing a skill, and what you have to do is install that skill, and then they'll be better. Or clients are missing insight. You've got to install the insight, and then they'll be better. Or they have irrational thinking, and what you have to do is install rational thinking, and then they'll be better. So all of it is kind of, I have what you need, and I'm going to give it to you. Motivational interviewing says you have what you need, and together we're going to find it. You already have what you need, and together we're going to find it. And it's calling forth from the person their own wisdom, their own resources, their own ideas, their own motivations for change. And then finally we added compassion. The primary reason for the conversation is the other person's welfare, because you can do the other three things and sell used cars. Those are all interpersonal influence techniques that once learned can be used in a whole variety of contexts. We're saying here the purpose is solely the other person's best interest. All right. We talk now about 4 fundamental processes. This is a whole new way of talking about and teaching motivational interviewing. First, engaging, so often ignored. You begin by collecting facts. What's intake? Intake, collecting a whole lot of information. Rogers said, that's no good to the client. They already know all that stuff. Yeah. Engaging, so you have a working relationship. And that can be done fairly rapidly. We're not talking about 20 sessions of engagement. You can see it happen in minutes within an MI session. Focusing, getting clear where we're going, what are the goals of our work together. Then evoking the thing that is most unique, I think, to motivational interviewing, calling forth the person's own ideas and motivations for change, and then developing a plan once the person is to the point of being willing to move forward. So far, summarizing an amazingly large database, MI training, we know, yields MI consistent changes in practice. And I'll talk a little, I'll certainly talk about that tomorrow some. That we're learning better and better how to teach people to do this. And we've tried a variety of different training strategies. So we can increase MI consistent practice. MI consistent practice yields more change talk and less resistance during treatment sessions. Those things predict behavior change outcomes. And that seems to be true across quite a few different problem areas. So this is not just something for addictions. As I said, it's being used in many different areas. Average effect size is small to medium with a lot of variability. So counselors seem to vary a lot in how well they do this and what outcomes they get. You see variability across studies also. Some studies find an effect, others don't. In a multi-site trial, with all the therapists trained together, MI works at some sites and not others. So there's something that we're missing that's important, that varies across delivery. I think we're getting hold of some of it, that accounts for some of this variability. What seems to matter? Therapeutic relationship. MI spirit and empathy, we know, are related to better outcomes, not just in motivational interviewing, in behavior therapy as well. The evoking of client change talk matters. We can predict from client change talk during a session how likely change is to happen from what the client's saying during the session. And what the client's saying during the session is a function of MI consistent practice. Also, decreasing client resistance is associated with change. And that's something that you see with a motivational interviewing session as well. A person may walk in very highly resistant, but it just kind of goes down over the course of the session. You're not responsible for the level of anger and resistance the client walks through the door with, but after that, it's up to you. Yeah. And then the counselor refraining from counter-therapeutic behavior. So maybe some of what we teach people is just not to do the wrong stuff. Don't get in their face. Don't scream at them. You don't do that with most things in the DSM, but somehow in addiction treatment that was good for them. It's not. Don't try to persuade. Don't give uninvited advice. Those things all kind of increase the pushback and resistance. And so perhaps if you can just stop people from doing those kinds of things, you get better outcomes. And by the way, these things all matter in counseling more generally, not just in motivational interviewing. So in a way, we're getting at what get called common factors or general factors or non-specific factors in counseling that matter besides the content of the therapist manual. Yeah. All right. We also, in the third edition, have said this is not just about behavior change. It's not just about stopping bad habits and not just about dealing with problems. Motivational interviewing can be used in a much broader way that involves human potential, and thereby it connects it back to the roots of motivational interviewing, which is a humanistic counseling approach. The work of Carl Rogers